Your health, your wealth. Hello there. A very good evening to you. I hope you're keeping well. I hope you are with people that you love and you're having just a really enjoyable Sunday. Looking after yourself, your mind and your body. And the thing about our bodies is that sometimes they carry viruses that we don't know about. We've heard about some which are better known, better talked about, more amplified, and yet there are others like hepatitis B. That's going to be the focus of our conversation today. And let me tell you something. I was telling the guests who are going to be here, in my big age, there's so little I knew about this virus. So why don't we collectively find out about it, because it is actually one of the most widespread viruses lying in a lot of our bodies. So if you have any questions, make sure you send them to us. We'll give you that information in just a moment. But first, here's a pulse check to take a look at exactly what people are saying about hepatitis B.
Najua unaogopanga STI na unaogopa HIV, but I am here to tell you you should fear something else. It's called hepatitis B virus.
My hepatitis B results came back positive.
They said my liver had really been, it like had corroded, and there was like somewhat fatty.
6 young adults, all below the age of 40, with stage 4 liver cancer. And they had hepatitis B that they never knew about.
And the bad thing is,
there is currently no documented cure for chronic hepatitis B.
hakuna dawa. Dawa nayo hakuna.
Avoid any risky behaviors that would, and let them understand. They also need to tell their partners.
Symptoms may range from mild to severe, and they include abdominal pain, fever, dark urine, or yellowish parts of your skin and the white parts of your eyes.
Hapa hivi tuna manage for life.
And there you have it, Tuna Manage for Life, right? We're going to get a little bit of information about it. But right now, let's have a look at the data. This is what paints the picture, the numbers. Let's bring those up and I'll share them with you in just a moment. Really interesting data that we all need to be aware of. And it says here that 254 million people were living with chronic hepatitis B globally in 2024. About 900,000 new chronic hepatitis B infections occur every year. Hepatitis B causes approximately 1.1 million deaths annually, mainly from liver cirrhosis and liver cancer. And hepatitis B accounts for 83% of all viral hepatitis deaths worldwide. So that's a look at hepatitis B by the numbers if we're looking at a global picture. But let's now transition to a more African picture, right? So Africa accounts for 68% of all new chronic hepatitis B infections globally. Only 17% of newborns in Africa receive the recommended hepatitis B birth dose vaccine, 17% only. Childhood hepatitis B vaccination coverage, which is a 3-dose series, stands at 72% below the World Health Organization target of 90%. And 1.4% of children under 5 in Africa are living with chronic hepatitis B. That's a look at the picture in Africa. Now, as always, on Healthy Nation, we go more granular. So let's take a look at the numbers in Kenya, just to take a look at what the situation is right now. There we go. Let's have a look. Approximately 1.5 million Kenyans are living with chronic hepatitis B. National hepatitis B prevalence is approximately 3%. And the highest regional prevalence is reported in the following areas: Northeastern at 7.6%, Rift Valley North at 5%, and Nyanza at 4.6%. And now the counties in Kenya with the highest reported prevalence include Turkana at 16.8%, Baringo at 11.9%, and Migori at 10%. This, of course, is according to the Kenya Ministry of Health. So why don't we take a look at diagnosis and treatment? It says only 13% of people living with chronic hepatitis B know their status. 87% remain undiagnosed, and fewer than 5% of all people living with chronic hepatitis B are receiving treatment. And then we take a look at the preventing mother-to-child transmission. There's a few others here. Now, without treatment, 70 to 90% of babies born to highly infectious mothers become infected. With timely birth dose vaccination and appropriate treatment, transmission drops to below 10%, and WHO recommends giving the hepatitis B birth dose vaccine within 24 hours of birth. Right? And I know we've mentioned this vaccine here and there, but why don't we take a look and get some information on this hepatitis B vaccination? Kenya's infant hepatitis B vaccination coverage is approximately 90%. The WHO recommends a birth dose vaccine, as we've just said, within the first 24 hours of birth. And finally, and this will lead us into our conversation in just a moment, let's take a look at the cost of hepatitis B. Hepatitis B causes approximately 1.1 million deaths each year. 60 to 80% of liver cancer cases in sub-Saharan Africa are linked to hepatitis B, and hepatitis B is one of the leading causes of liver cirrhosis and liver cancer in Kenya. I know that's a mouthful, but like I said, it just really feels like one of those under-discussed diseases and viruses. And that's why we're having this conversation. And that's why I'm joined in studio by our guests. But first, I want to tell you how you can talk to us. WhatsApp, 0769 590 769. Is it 769 or 760? My memory sometimes. But we're going to give you those details in just a moment. On YouTube and Facebook, we're live, so talk to us. And of course, our guests, Knight Sheraton Amor is living with a hepatitis B diagnosis. She joins me right here, and she's going to talk us through her own journey, how she discovered she had it, and how she's living with it, and what we all need to know. And then we have Dr. Khadija Hassan, who is a viral hepatitis manager at Kenya's Ministry of Health, NASCOP, and the person who sits at the center of Kenya's national response to the disease. And as we invite them both, thank you so much, both of you, for being here. I think you have your microphones there. Dr. Ari, just before we come to you, Knight, thank you so much for being with us. Tell us about when you found out you had hepatitis B. What was going through your mind and what was happening in your body?
Okay, thank you for inviting me over here. Thank you for giving me this platform, because it's not for everybody. And at least I'm here to let my fellow Kenyans to know how we walk this journey. And they are not alone, we are here together to share this story. So, how I came to know about my status, I was pregnant. And I went out for my normal ANC checkups. And that is when they discovered I had the virus. Yeah.
During that, when you were doing one of the prenatal checkups,
yeah.
When they told you that you had it, were you worried? Did they say something that made you feel relaxed, or did they tell you something that made you worry?
No, exactly what my doctor told me. He actually told me this is nothing to worry about. And Makiu, that was my very, very first time hearing about this virus called hepatitis B.
Yeah.
I've never heard of it anywhere. So when he told me that, I was like, I have nothing to worry about. Mm-hmm. With time, it will just go by itself.
Okay.
Yeah.
Did it affect you during the rest of your pregnancy journey, or that was it? The doctor was like, Knight, you don't have to worry about anything. You'll carry your pregnancy well. Or at some point towards the end of your pregnancy journey, did it show up at all in any way?
Yes, I did worry very, very much. After some time, after now going through, I went back home, started searching about this virus, and I was like, why didn't just the doctor tell me it is this and this and this? At least I could have had some information. So, like, I was very bitter with myself. Why he did not tell me how the virus goes about.
Yeah, and just before we bring in Daktari, so just to be clear, Knight, you had no symptoms, nothing?
No.
Nothing? No. You were just told you have hepatitis B, but uko tu sawa?
Yeah.
Wow. Dr. Ari, is this how it shows up a lot in terms of people just not knowing they have it, and then, you know, someone living with hepatitis B and they have no idea? Is that something you come across often?
Yeah, actually, exactly. That is how it is. Hepatitis B is a silent killer.
Mm-hmm.
You live with it without symptoms for 20 to 30 years. So it's very true.
Mm-hmm.
It was incidentally discovered because she had gone to ANC. And in Kenya, we are testing all our ANC mothers who show up in our facilities.
Mm-hmm. Before we go further, we need a really quick recap of what hepatitis B is. I know people hear hepatitis, and there's several. There's A, B, C, D, E. So what is it, and why should we be worried about it, as briefly as you can? Yeah.
So when you say hepatitis, is inflammation of the liver, liver cells. And there are several causes and several agents that can cause, including lifestyle, like alcohol, excessive alcohol. We also have aflatoxin. We have bacteria. But there are several viruses also which can cause hepatitis. But of importance is hepatitis B and C. And now the center of discussion B, because as you've seen the statistics that you've just given us, 83% of those cases are due to hepatitis B, and that's why it's very important to have these conversations.
Mm-hmm.
So we have A, B, C, D, E. A and E are orophycal, meaning that you get them from food, contaminated food and water.
Okay.
And they are most of the time self-limiting. They cause acute infection.
Mm-hmm.
But for B, C, and D, they cause chronic. D cannot affect it on its own. It requires hepatitis B for it to survive.
Okay. Not a lot of people have this information. And then it's also called a silent disease. So then what's happening in the liver when somebody has hepatitis B that appears silent in the body, but what's actually happening in the liver?
So there are three scenarios. Once you are infected with the hepatitis B, your immune system might decide to ignore it. And that's now where we have acute, highly infective. And it just goes silent. And over years, it's slow. Your liver is intact, but you do have the disease, and you can infect people.
Mm-hmm.
And you can go to a fulminant, that is acute liver failure. Secondly, your immune system can detect the virus and start fighting it. And that's now where you have liver damage. Cirrhosis, what we call cirrhosis, that is scarring of the liver lining.
Mm-hmm.
And slowly you go until now you have cancer of the liver.
Okay.
And the third one
mm-hmm.
is your immune system will fight and now win the battle, mm-hmm. like our guest here.
Like Night.
Night, yes.
Thank you for that. Thank you for breaking it down simply. But Night, you said you went home and researched. Was the first thing you thought of is, this thing is going to affect my liver? Did you take action after researching, or did you just say, I'm just going to trust that nothing bad is going to happen to me?
After doing my research everywhere, I was not still contented with the results that I got from the hospital. I went to another hospital, went and double-checked, and indeed it was confirmed. After that, I was referred. I was told the only hospital that can manage it is KNH. Mm-hmm. That is where I was referred to. I went there and did my things. Yeah.
What things? Your tests?
No, I went there and they started following up my scenario.
Okay.
Yeah, where they told me to go for the test.
Mm-hmm.
Yeah.
So what's supposed to happen, Dr. Ari? Ideally, Night went for a prenatal visit. That's when it was detected. It sounds like she was casually told, you have hepatitis B, you have nothing to worry about. Ideally, what is supposed to happen? If somebody it's detected, what are the next steps that a doctor is supposed to walk you through?
So once you are detected, meaning that you are screened, what you are doing is screening for all our ANC mothers, and we use hepatitis surface antigen, just a screening test. So once you are screened positive and you are pregnant, we are supposed to do your DNA again to see the amount of virus in your blood, because there is certain threshold that once you reach there, then your baby is at risk, and we are supposed to put you on prophylaxis to protect the baby.
You were not what happened with this baby? Also, there was a risk that it's mother to child transmission, sexually transmitted as well, and other factors such as sharing of razors and sterilized equipment, which we'll come to in just a moment. But in your case, were you told your baby could be in danger, or this is not information that you had?
I was told my baby was not in any danger. So even the drugs, I was not given. Yeah.
But by the time you went for the second opinion, is that when you were put on medication?
No, I'm not in any medication up to right now.
Okay. And you're a champion for it, right? Because, is it because you realized how dangerous it could be? Because, Knight, you could have done your whole journey. You have a healthy baby, right?
Yeah.
Congratulations.
Thank
You're healthy, your baby is healthy. But what is it that has made you say, no, we need to talk more about this?
I think people out here, people out here, they don't have the awareness about this virus,
Okay.
So I think we should be given a platform whereby we create awareness to the people. Because even for me, were it not for me going to the ANC, I could have not realized that I'm infected.
Okay.
Yeah.
We'll come to that in a moment. We'll come to exactly what kind of advocacy is being done. But Doctor, I want to come back to you right now. Somebody is watching this and they're not yet sure that they should be alarmed. I know that sounds like a strange thing, because when you look at the data, a lot of Kenyans are moving through life without an actual concern around hepatitis B. So talk to Kenyans today. Is there 1, 2, 3 things that you need them to know that will make them take hepatitis B seriously? Beyond what you've talked about, cirrhosis, etc. Kuna mtu anaketi sahi, they're like, it doesn't sound like that thing can affect me. Or, Daktari has said, maybe the body will fight it and it will go away. Why should that person be concerned?
You should be concerned by viral hepatitis because one thing is silent. You will not see symptoms. It will slowly kill you by the time you are 30 years and above. And it is important to go out there to be screened. The screening is available. It is free within our facilities. Go and know your status today. And if you are diagnosed to be positive, with their care and also treatment is available and very cheap.
We'll come later even to things like the vaccine. Knight, going back to you, did you share this with any family? And if you did, was there any kind of reaction, stigma, or what was the reaction when you told people, I've just been told I have hepatitis B?
Okay. I say thank you to my family members. They've been so supportive. And when I broke the news to them, they were like, no, do not give up. We'll walk you through the journey. And as for me, I did not face any stigma. Yeah.
Do you know of people who face stigma? Doc, maybe you can talk to it. Is it something that people often face?
Yeah, because the transmission mirrors that of HIV, sexually transmitted. The other means, but you see, sexuality in Africa is something that bothers people. So the stigma is very high, and that's why we want to demystify that one and create awareness that this is just a chronic illness, just like any other, which can be managed.
Okay, so there's some scenarios where somebody has been diagnosed with hepatitis B, and when they share it with either their loved ones or their family, the initial reaction is, you've been sexually irresponsible, or is that what it is?
Exactly.
Okay, that's what it is.
Exactly.
Yeah, and yet it could also be other causes. Maybe you can walk them through. I know we mentioned them briefly, but it's very much mirrors HIV, right? In the sense of sexually transmitted, mother to child. What are some of the other causes?
Yeah, to sum it, the causes is blood and other body fluids, contaminated blood and other body fluids, whether it's sexually unprotected sex in that case, or using sharp needles. Our healthcare workers, for instance, are at very high. They're among the risky category, risk group. And because they, as in their routine job, they are frontliners, and most of them do get incidentally. And because it's silent, you don't care about it, and some years later, now you start getting complications.
Yes. And also, I think one of the things I saw was unsterilized salon equipment, and that kind of thing. So what else? I mean, when you look at somebody going, these are things we do every day. We go to do our hair in the salon. These things that we do every day in our life. What are the things that we need to be careful about, or what do we need to look out for so as not to run that risk of being infected with hepatitis?
Any sharp object like tattooing, anything that will prick your skin and go in contact with your body fluid and to another person. If you are infected, you definitely transmit. For example, those people who practice FGM, and that's why in the northern part, the Turkanas, we're seeing high burden because we could not know the root cause, but we are suspecting that probably this is. We also have Bungoma rising from nowhere being high burden, and we are suspecting that reuse of those unsterilized pricking or sharp objects could be the cause that is transmitting the disease.
The other place you flagged was Baringo. Is it also similarly the same thing?
Yeah, it is. Baringo is a diversity county, so we do have the nomadic and those who still practice FGM.
Do you know how you got infected with hepatitis B, Knight? Do you have any idea what could have happened?
Actually, don't have any idea.
You don't?
Yeah.
Okay. And I think what I'm trying to understand is, and maybe you can help me, Knight right now she's fine in the sense of, I know backstage there when we were talking just a bit, I was like, okay, so does it mean that the virus is sleeping? You said it's sleeping, and I asked, are there flare-ups? And you said no. So I think I'm trying to understand when and how it manifests, and if it doesn't, does she ever have anything to worry about going forward in life?
When we talk of care doesn't mean treatment. So Knight being diagnosed positive, she needs to be monitored because the virus right now is latent, and that's why the background is telling you it's sleeping. It's not doing any harm. The immune system is not recognizing it as now, it's not fighting. Because what causes the cirrhosis is not actually the virus, it's the immune system attacking the virus. So right now her immune system the virus is latent, it's not replicating, it's not causing any harm. But it's important to monitor because the day it will wake up, now it will start causing havoc. So it is important for her to be checked, and what you are checking is the DNA, that to see whether there is the number of copies, because luckily for this one we need copy of like 2,000 for it for her to be eligible for treatment.
Thank you for speaking to that. So right now it's just constant monitoring. How often? What does it look like to be monitored?
3 to 6 months we check her DNA, the virus DNA, not her DNA.
Yeah. How do you feel, Knight? Do you sometimes feel nervous, like I don't know whether this thing is going to grow into anything, or are you not at a place where you're being monitored enough and you feel confident that things are being managed?
Okay, where I am right now, I can say I've been better. And as time goes by, I know I'll be more better because each and every single day I learn new things through this virus. Yeah, and I hope with time we'll be okay.
No, I hope so too.
Yeah.
And I'm glad that you're always taking the time to educate yourself. I think that's so important. But when it goes back again to educating ourselves, Dr. it says I think the data I have is fewer than 5% of people with chronic hepatitis B in Kenya are on treatment. Fewer than 5%. So as somebody who's managing this viral health program in Kenya, where do you think things are going wrong? Where do you think we're going wrong?
Yeah, the 5% is actually globally.
Okay.
So the silent epidemic and the silence that it's given by the authorities is not only Kenya, it's globally. And you see 13% is also global that know their status. So people don't know they are living with this virus, and therefore none or very little of them are on treatment. Secondly, as a program, the Ministry of Health is taking care of the pregnant woman and not the general population. So those with chronic, the 1.9 million in Kenya who are believed to live with chronic hepatitis are actually not taken care of. There is no concrete medication that is set aside or procured because of the general population. We're taking care, like for example, Knight will tell us when she was diagnosed, was she told to bring her husband to be tested also? Because by the time she's coming, it is prudent that she had unsafe sex, and that's why she got pregnant. And there is a sexual partner who was responsible for that. And this disease is transmitted sexually, and yet she was not told to bring the contact. She can share if she was told, and correct me.
Yes. Share with us. And just before you do, Knight, because I think it's important that we go to that, remember that you can call us live. The number is 0719-038-858, and you can WhatsApp your questions to 0769-590-762. We have a lot of feedback coming in just kind of regarding a question we'd asked on our NTV Kenya page. People like Red's Johnny, a lot of diseases are happening that government is talking about. What exactly is going on? So I think somebody is alarmed by what they're thinking is a lot of what they're calling advertisement of diseases. But just to know that World Hepatitis B is on Tuesday, and Dr. and Knight will tell us more about it. That's why we're having this conversation. And just before we go to the break, I wanted to ask Knight something that Dr. has just said, which is what exactly was supposed to have happened, right? Okay.
Okay. When I was told by the hospital that I was positive, I told my husband the news, and together we decided to go check in another hospital, and we did go together, and he was confirmed negative. Yeah. Mm-hmm. And we always work together, but he is very safe.
Okay.
Yeah.
Were you bringing that up because in other scenarios, it's supposed to be that it happens that people don't do that? That's what you mean?
But what she has told us, they went to another hospital. My question was where she was diagnosed and where she was attending ANC. Was she told to bring the sexual partner or the husband in this case?
Was she told? Were you told, Knight?
I was not told.
So that's a gap.
It was just out of our concern.
Okay.
Yeah.
That's a gap. And is it lack of information? Is it lack of urgency around hepatitis B? Why did that gap exist at the medical center where Knight went, in your opinion?
So unfortunately, like I said, there's specific groups that are programmed for, and the general population is not programmed. And that's why ANC mothers are to be tested. And the babies, if they test positive, the babies are to, the mother is supposed to be put on prophylaxis to prevent the baby, but they are never concerned with the husband, who now becomes the general population.
Okay,
that's
got
the
it.
gap that exists, and that's the gaps that you want to close.
Mm-hmm. So, if we have a lot more focus on those who could be seen to be carrying, because that's a carrier, right? Is that what you're saying? That we need awareness that even in communities, husbands and the partners are also tested, and that's not being done enough, right? That's not happening enough.
That's not happening, but now we are shifting towards that. Mm-hmm. Remember, we didn't have even policy guiding that. Mm-hmm. But in 2026, approaching the integrated manner, HIV, hepatitis, and STI are integrated in the new guideline. We have a new guideline for treatment, diagnosis, and prevention of HIV, STI, and hepatitis. Mm-hmm. And it was just launched this year, sometimes in March. And the training has gone out in the 47 counties. So we are seeing a change, a paradigm shift from traditional to now integrated manner where everyone will be included and be tested and be put in the appropriate treatment and care.
Okay. And just going back to your baby now, Knight, how old is your baby now?
She's 10 months.
She's 10 months,
yeah,
okay.
10
And she's
months.
happy, healthy baby. Is there also the need to monitor your baby? Is your baby also being monitored or not necessarily?
I don't think she's supposed to be monitored because after me giving birth, I ensured that she was vaccinated. Mm-hmm. Yeah.
So she's okay.
Yeah.
And I know we're going into a break in just a moment. We need to talk about vaccination. Dr. I think we have a minute or so to the break. What can you tell us? I mean, is it expensive? There's been shortages. Some people have said that they've had babies who the vaccine was not available at the time of birth. It's supposed to be within the first 24 hours. Is that a concern that has arrived at your desk, that there is an issue around access to vaccines?
Yeah, so let me first start. The vaccinations we're talking about is the one which is in our NVIP, the National Immunization Program, which was rolled out in Kenya in 2023. So any child who was born with that gets the 3 doses of pentavalent. Mm-hmm. That is 6 weeks, 10 weeks, and 14. But then WHO introduced now the birth dose vaccine, which is to be given within 24 hours. Mm-hmm. In fact, it's supposed to be universal. But more importantly, if now the case of Knight, if you are positive, regardless of your DNA, your baby is supposed to get. But our guideline talks of universal birth dose. But now, up to date, Kenya is yet to roll out the birth dose, and that's why people are saying it's not there. We have not rolled out the birth dose vaccine.
Oh my. Okay, there's a question that we're going to bring up on the screen and see if you can answer it again as we go into the break. Because we are inviting you to ask your questions. Harrison is asking, I'm positive for 8 years now, no treatment, no symptoms. Kindly help me on what to or who to connect with the doctor, how to connect with the doctor. So that's Harrison says he's been positive for 8 years, no treatment, no symptoms. Harrison, will try our best to see at the end of the show how to redirect you. In the meantime, what can you say to Harrison as we move towards a break?
So his case is where we were saying hepatitis B can cause both acute and chronic. So hepatitis B that is acquired in infancy or at birth has more than 90% chances of going to chronicity. But if it is acquired in adulthood, only 5% of those who acquire in adulthood go to chronicity. The rest, the body self-limits.
Okay. Let's pause there. We're talking about hepatitis B, a virus that lives in the body very silently, but if not monitored, can cause an infection, especially when we're looking at the liver. And that's what we're trying to understand. We're going into a break. Remember that you can call us on 0719-038-858 or WhatsApp us on 0769-590-762. You can also chat to us on our live feed. Healthy Nation is back after this break.
Nahitaji manukato ya kunituliza yanayoniweka fresh kwa joto, niwe maridadi siku nzima na kudumu zaidi ya manukato ya gharama. Downy mpya, Lavender Calm, Sunrise Fresh, Sweet Elegance, freshness na kujiamini.
We love to share our cultures. And the one thing that unites us all, that celebrates precious moments, nurtures our Kenyan spirit, drives success, welcomes,
the more the milk, the better the chai,
and even inspires. Our language does all of this and more. Na ni lugha ambayo kila Mkenya anajua. The more the milk, the better the chai. Chai kweli ina Brookside Dairy Best.
This is NTV.
Ujayo katika NTV Weekendi. Kura za jamii ya Mulembe zatafutwa kwa dhati. Linda Mwananchi kimtaka Sifuna kuwa rais wa 6, huku ODM ikimtaka Ruto kumkubali waziri Wycliffe Oparanya kuwa mgombea mwenza mwaka 2027.
Siku ile mimi nitaenda kwa NCIC, lazima tuandamane na Rigathi Gachagua. Mimi nitaenda na mawakili zangu kama Ahmed Nasir, Rigathi Gachagua kuja na mawakili zako.
Waziri wa Afya Eden Duale atakiwa kujiuzulu kwa tuhuma za semi za uchochezi dhidi ya jamii za Mlima Kenya.
Kuna wakati pia hii shule last year tulikuwa na wanafunzi wawili peke yake. The school was about to be closed because according to the policy of the ministry, when the learners are below 10, then the school has to be closed.
Na katika makala yetu maalum, shule Taita Taveta zimo katika hatari ya kufungwa kutokana na uhaba wa wanafunzi. Kunani?
This week on Twende, we are heading into Kenya's biggest desert. A place where life survives against all odds.
As far as the eye can see, you hausikii boda. If it's not for our cars, it's nothing. It's just the wind. If you want a proper reset, this is the place to come.
We discover why parts of this desert appear white as snow. And we visit the oases that make life possible in one of Kenya's harshest environments. Travel with us through the expansive county, only on NTV.
You feel that? The crash zone.
Crash what?
The crash zone. It builds suspense, uncovers evidence, foreshadows danger. You feel it now?
Oh, yeah.
I guess I'll go and try and find a ladder.
This is Healthy Nation, and we're talking about hepatitis B today. And in just a moment, we'll be opening the health hotline. Dr. Dana Gitao will be joining us. She is our in-house doctor. She's going to be answering questions that you have in your mind, aside from what we're talking about today. So be on standby for that segment. But first, we're still in studio with Knight, who is living with hepatitis B, and of course, Dr. Khadija, who is really on top of managing this virus countrywide, and also just talking about the fact that it is under-amplified and under-centered, and we need to raise more awareness. A lot of you have been sending your feedback. Then we're also going to bring up the question of the day and see how some of you interacted with it. Let's bring that up because I think it's important that we pose a question that allows you to go deeper. What is the biggest myth you've heard about hepatitis B? What is the biggest myth that you've heard about hepatitis B? And as you share your answers, we'll also ask our guests today what the biggest myth they've heard and how we need to debunk it. And later on, we'll also be sharing some of the feedback that showed up on our Facebook page regarding hepatitis B. So what is the biggest myth that you hear about hepatitis B? Let's start with you, Dr. Ari.
So the myth is people are saying it's a curse. You need to visit the witchcraft, turn to herbalist, and you shy off coming out to hospital.
Mm-hmm.
And as you know, it's a silent. So by the time you going to the herbalist, time is on your, not your side. Your resilient organ, the vital organ liver, is damaged.
Okay. Is that also a myth that you've heard, Knight?
Yeah.
About herbs. Okay. Yes. Tancred Purity on Facebook asks, can an ultrasound detect all the cells in a tissue? Are you able to speak to that?
Yeah, you see, ultrasound shows us the morphology of the organ. So if there is cirrhosis, definitely it will show.
Mm-hmm.
Yes.
Okay. I know Gripina Mukungu says, I've just heard that in Amaliza liver, it's a death sentence if not dealt with early enough. I think that's something that you brought up. And then there's somebody else that is asking a question. Unfortunately, not quite able to look at the picture on the screen, or rather the detail on the screen. And I hope that we can perhaps read it out in just a moment. There is something that's up on the screen that we'll be able to share with our guests once I'm able to take a better look at it. If somebody was born in the 1980s and they're not sure that they were vaccinated for hepatitis B, what should they do, Dr. Ari?
The vaccine for hepatitis in Kenya was rolled out in 2003.
Mm-hmm.
So 1980, we did not have this vaccine. So unless you are vaccinated in adulthood, like me when I was in the university, then there is likelihood that you are not vaccinated. So if you've never been vaccinated, please get tested. And if you luckily test negative, then ensure that you are vaccinated. And there are three vaccines. There are 3 doses that you are given in different.
Okay, let's come to that. Adult vaccination. I think that's very important. But there's a question here from Charlotte. Good evening, Janet. I'm Charlotte Chitsaka from Embu County. I have a question since I'm a medical student. What are the symptoms of hepatitis B and the prevention of this disease? Although I've learnt it in class, but can you explain in detail? I feel like we've spoken to this a little bit, but Dr. just for the sake of simplifying it, what are the symptoms? If there are none, you can tell us there are none. If there are any, tell us what it starts to look like. And then I think she also asks the prevention of this disease.
So the symptoms are there. Mm-hmm. Although silent, it will show. And some of them you might not differentiate. This fever, lethargy, nausea, vomiting. Then you need to do differentials because there are so many other diseases that have the same symptoms. But as the liver cirrhosis and fibrosis continues, then that's where now you will have the signs, like hepatomegaly, meaning that enlargement of the liver, enlargement of the spleen. Jaundice will show because of accumulation of bilirubin, because the liver is the one which is responsible. You will also get encephalopathy, that is confusion, because pneumonia builds up in your brain.
So when you start to manifest those, it means it's also gotten to an advanced stage.
Exactly.
Okay, that's unfortunate. Another question here. Hi, Janet. Thank you for this health segment on hepatitis B today. My name is Kibet from Baringo. I'm a victim of this monster. He describes it as a monster, chronic hepatitis B. I was recently diagnosed with liver cancer caused by this disease. The treatment has been brutal, including surgery abroad. It's really costly, and it mutates to cancer. I will now be on hepatitis B drugs for life. I urge leaders, especially from high prevalent counties, to prioritize screening and early treatment. Please highlight this silent monster more and more. Thank you so much, Kibet, for talking to us about what it is that you've dealt with. We are so sorry that this is something that has advanced so far. Is this also why you are finding it so important, Dr. that this becomes a central focus of health in Kenya? Because from what you've told me, it's buried under other diseases. There's barely any funding, barely any research. So how do we then get to the place where it is amplified and treated accordingly? What kind of advocacy needs to happen from this show for that to happen?
To intensify, like now Knight has told us, she never knew. And not only the patient or the clients, but even the healthcare workers know little about hepatitis B. 6 months ago, I was also not very serious about hepatitis B until I came to the viral hepatitis section. And that's why I got the interest to know what's happening. Data which informs decision-making and resource allocation is not there for hepatitis. No one collects data. We do not have surveillance system. People are not screened. People don't know their status. And now this is the time. We have come with the policies. They are in paper, but this is the time for action. And as we celebrate the Viral Hepatitis Day on 28th, we are saying let's break these barriers.
Okay. Thank you so much for that. There's another question here. Hi, Janet. Finally, the conversation I've been waiting for. I have a very crazy story of living with hepatitis B. This should be mandatory in every hospital, but right now, allow me to point out the gaps in the virus's care, especially for the men. Also, the costs are high. It's good to see what ANC is doing. Can men also come for checkups? How much do they charge for the viral load testing? So let's see if we can do a quick fire on that. Number one, let's go to the cost. How much is the charge for the viral load testing?
The viral load testing privately, it's costly for a common Kenyan, but I don't want to dwell on how it costs. I want, as we're doing the celebration in Baringo, the DNA, the testing is going on for free, courtesy of Remedy. And that's now I want to showcase so that we can have point of care molecular testing to where the disease is.
Okay. And then, of course, she's saying what we've already discussed on this program, which is we need more men to come forward for testing, right?
Exactly.
She's pointed that out. She said especially for men.
Exactly, because the general population, what I'm calling the general population, is not programmed for. And this is the time to program, to see the Kenyan, the 50 plus million are all Kenyans who need to know to ascertain their status by screening, and if they are positive, to be linked to care. They deserve, it's health for everyone, universal health coverage.
All right, just before we come tonight and wind up this segment, John is asking, is there full treatment for hepatitis B? Can antivirals control multiplication of the cell?
Exactly. That's why you are saying come out to be screened, tested, and linked to care. And the prognosis is very good. If we catch you earlier and we'll reserve your liver and will not go to cirrhosis.
Just before we bid you goodbye, Daktari, and thank you so much for the information you've given us. You were going to talk about vaccination as an adult. Should we all be looking to get vaccinated as adults who were born in the 80s when this didn't exist? I'm trying to understand around that. Just very briefly, you had made a point. What were you trying to advise those who did not have this vaccine?
If you are not vaccinated, you are saying get tested. And if you likely test negative, ensure you prevent, because prevention is better than cure. Once you are prevented, it confers immunity for over 20 years and sometimes for life.
Okay.
So get adult vaccination.
Get the adult vaccination. Knight, what is your final message from the conversation today? What do you want people to know, and what do you need Kenyans to know tonight?
From my own angle, I'd like to tell Kenyans that be it that you've tested positive, do not let that information drown you. Or rather, you take that as an opportunity and you shine, and let us spread this message to other Kenyans so that they can be aware of their status. And let us, together we stand, we finish the virus.
Okay. Thank you both so much. I think our guests have really broken this down really well. It's just talking about prevention. It's talking about monitoring. It's talking about we need to prioritize this matter as well. So I would truly like to thank them for joining me in studio today. Dr. Hassan, who's been with us, and Knight as well, who's shared her story. Thank you both so much for being here. Let's bring up some more of your feedback. And remember, in just a few seconds, Dr. Dana Gitar will be joining us. We're opening the health hotline on Healthy Nation to answer some of your key critical questions around hepatitis B, but also around other matters. Let's see if we can bring that up right now as we welcome her onto the set. Thank you very much. There we have it. There's some more feedback on your screens as a lot of you continue to ask questions, which are really, really important in the conversation today. And of course, I can see Brian Ouma saying this is amazing and educative. So thank you very much. We've seen the questions now. Mulash Lash is saying, mgonjwa zingine ni uncommon. Kwanza, how can a person prevent themselves from contracting hepatitis, yet we don't know about its signs and symptoms, and in school, we are taught it as an STI. And then, of course, again, we have Agrippina Mukungu, who mentioned something earlier saying, just heard in Amaliza liver, it's a death sentence if not dealt with enough. So really, really quite jarring to get this information. Health Hotline officially begins. Daktari, good to have you in studio.
Thank you, Janet.
Yes. Quick reflections as we answer some other questions related, even outside of hepatitis B. Quick reflections on what you've heard today.
I think one, it's the element around if I've been vaccinated at birth, how can I get hepatitis again, right? And it's that reminder that vaccines, as the doctor mentioned, sometimes do wear off. Your immunity does wear off, and it's not always 100% as well, yeah? There's the element around the difference between hepatitis A, B, and C, right? Hepatitis B being the chronic one, C does not have a vaccine, and A is transmitted with food and water, contaminated food and water.
Yeah, and so, yeah, you talked about the difference between hepatitis A and B. And then if vaccinated at birth, why still worry? Why should you still worry if you've been vaccinated at birth?
Remember, vaccination essentially is getting your body to be aware and to be ready to fight, right? So over time, those soldiers, some of them die off, right? Get tired. So that memory sometimes wears off. That's why even when you find like pentavalent, which is the vaccine for hepatitis, is given 3 doses because one, it introduces that form of hepatitis in your body. The second, it's of strength and then memory, right?
And that's when what age? How do you spread out the 3 doses? It's from what stage to what stage?
So nowadays it's recommended at birth, but typically it was at 6 weeks, 10 weeks, and 14 weeks as well, right? And there's the question around adults as well, right? So if, for example, you get exposed The first thing is usually within 24 hours, you should get some antibodies, right? And if you haven't gotten exposed, and for example, you have never gotten vaccinated and you're interested in getting vaccinated, you can get the 3 vaccines as well. You still get it at period 0, I think a month, and 6 months as well. Yeah.
This is all really good to know. How long does the hepatitis B remain on needles?
So hepatitis B in particular is very hardy, right? You would say about 5 to 7 days. And this is why it's important that if you're getting a tattoo, if you're getting shaved, that you ask for sterilization, or if they can use a new razor and so on, and a needle as well. So about 5 to 7 days.
So a lot of it is down to sterilization and being careful. And again, from the reading I saw, it was tattoos, it was salons and everything. So is there a 1, 2, 3 that people need to keep in mind if they're running these businesses and these institutions? Is there a sort of like a required way to do it, or is it just common knowledge that people should know? Just sterilize your instruments.
I would hope it's common knowledge during training, but I think it's also an element of business providers as well, insisting on certain standards, right? That if you're in a facility or in the salon, right? If you're a tattoo artist, of course you want to sterilize your equipment. So it's just basic standards as well.
Okay.
And you asking, is it sterilized as well, especially for tattoos?
Yeah, no, you're right. Somebody had asked about ultrasound. Can an ultrasound detect the cells in the tissue? I know Dr. Hassan mentioned it, but yeah, speak to us a little bit about that.
So you'd have to get a blood test, right? Because then it is a viral infection, meaning it's spreading through your blood, right? And this is why the transmission. So the blood test is important as well, right? Maybe what it might do is aid in screening for, elimination purposes, right? But blood test is usually the go-to standard, yeah.
Okay, somebody has asked a question.
Yeah.
I don't know if it's, anyway, they've said, is the disease grounds for divorce? This is why we call it the health hotline. Just ask. Fungua roho, uliza tu.
Yeah.
What have you seen?
I don't think so. And all these things are personal, right? But first of all, it doesn't mean it's sexually transmitted, right? What if this guy got it when he was getting a tattoo? Does that mean you have to divorce him because he got a tattoo and he got infected? So I don't think so, but it's a personal decision. Also, remember, sex in itself is not the primary transmission method as well. So blood is, right? And body fluids, right? Okay. So yeah, you have to keep that in mind.
You have to be sure. Somebody again has brought up dental cavities on the rise. Have you noticed every Sunday we get a question on dental?
It is.
Yeah. Just, is that something that's happening, dental cavities on the rise?
I would say maybe yes, given the fact that we're eating more sugary foods, we're not as careful as we were before as well, right? So you could say we're having more acidic food and so on and so forth. Yes, but always remember the element around quack doctors, quack dentists is also a factor as well.
You mentioned that, and I think it's important for you to keep emphasizing. Somebody else says they're in Nairobi, they're asking, please ask Daktari, where can one get care or medication if positive? I think going back to the hepatitis B.
I think any public facility would be able to offer a private facility as well. If you walked in, I know Dr. Khadija is based at Kenyatta National Hospital as well, right? So if you're walking in any public facility, you should be able to request a test, or they will refer you to another public health facility that can offer the same.
How do we advocate for some of these illnesses and viruses to be prioritized? Because there's a lot of people learning about this. Like, again, somebody like Brian Ouma saying this is amazing. So how do we advocate, Daktari? This is part of it, but what does it need to happen for this to be top of mind, given the scale of infections? As we close, how can we advocate better? And what exactly do we need to advocate for? Is it screening? Is it funding? What is it?
I think it's screening, right? Because a lot of people don't know they have it, right? A lot of people are not even aware there's hepatitis, for example, right? Maybe mothers will know because it's part of their antenatal care. I think screening awareness is primary. The fact that vaccination is done at birth, I think there's also that emphasis that get your child vaccinated, right, in this day and age. It will help, not just now, but later.
Dr. Dana Gitau, as always, really great with the quick fire hotline questions. And thank you, as always, for engaging us. Healthy Nation is essentially, for me, Doctor, can I tell you, prevention. Get ahead of these things. Go for the screening. Make sure that your vaccines are up to date. Have these conversations with your family, with your partner, with your friends. Let's not be afraid of understanding what's happening in our bodies. Let's prioritize it. Healthy Nation, I'm Janet Bogwa. Let's keep the conversation going. Have a good evening and the rest of the week. Have a very happy, healthy week ahead as well. The news is up next.